Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, everyone benefits from regular dental checkups. But as noted by some renowned associations, more than 20% of patients have not seen a dentist in the past few years. 59% say they cannot afford regular visits, while 22% point to fear of dental care and 19% highlight issues with finding a convenient location or time. But dentistry has advanced a lot today. So to discuss on the advancement of dentistry in today's world, we are being joined today by Dr. Banashri Bordoloi, consultant dental surgeon and oral implantologist. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Thank you so much, Doctor, for joining to Good Life, the health show. So, of course, the dentistry has nowadays very much advanced in today's world. So, if we talk about how has dentistry changed today, what would you like to tell?
Dentistry has changed a lot.
A lot.
A great many lot. I mean, right from implants to bleaching your teeth, designing your smile, correction of your crowded teeth. It is all about latest technology and advancement.
Okay.
It gives us dentists immense pleasure in correcting one smile, giving you a beautiful smile. It is really a great pleasure, actually. Yeah. And, for missing teeth, you no longer have to rely on those removable dentures. You can have fixed teeth with implants, good as your own teeth, actually.
Okay.
So, yeah.
Okay. Now, what are the latest treatments developed in the field of dentistry, Doctor?
Latest RCTs, root canal treatments, where, when you have exposed teeth. Exposed, I mean you have pain in your tooth and you need not extract it. You can go for root canal treatment, which is removal of your pulp chamber, pulp tissues, which is composed of nerves and blood vessels, cleaning it up and making it non-vital, but with a cap, it is as functional as your other teeth. So that itself is an advancement, and it can be done in a single sitting nowadays. You need not go for multiple appointments to a dentist, and you can have your tooth which is decayed with lot of pain, but you need not extract it. You can very well keep it safe for the rest of your life.
Okay. So you said that it's only a single day affair nowadays. So you did not have to go for a lot of sittings to a dentist. So what we have seen is that when a patient goes to a dentist, a lot of medicines or antibiotics are being given prior to their treatment. So is it necessary for all the patients or depends on the case?
It depends on the case, yes. And yes, actually oral cavity is very much prone to infection. So prophylactically, we do give antibiotics a lot than other doctors. But nowadays, we assess the situation and then only we prefer to prescribe antibiotics.
Okay.
And yeah.
Now, doctor, what is crowded teeth? Now, what happens when you have a crowded teeth? What is exactly the term about?
It is a malocclusion, actually. There is a proper occlusion where the upper and the lower teeth meet, and you have a proper, centric occlusion, what we say in our own medical term. By crowded teeth, we mean that when your milk teeth are about to, exfoliate, when it is not taken proper care and it is retained for a longer time, then the permanent teeth tends to erupt out of their arch, you know.
Okay.
It might erupt inwardly, outwardly. So then the crowding occurs. The crowding basically occurs in the permanent dentition. And there are means of correcting that as well nowadays.
Okay.
That is taken care by the orthodontic part of our dentistry. Dentistry itself is a very, very vast subject. So every aspect is taken care of by different departments.
Okay.
This crowding of teeth is taken care of by the orthodontic department. So where we put braces, where we put nowadays clear aligners have come up, where you need not wear braces, you know.
Okay.
You can wear clear aligners, and then your teeth are corrected, and you get a beautiful smile.
Okay, now latest treatments have come up, and as you said, that dentistry itself is a vast subject, and a lot of departments are there to take care of everything. So of course there will be a lot of study, and of course maybe there must be some workshops as well, which you dentists have to attend, and a lot of like information, knowledge gets being discussed amongst yourself also. So if we talk about these workshops, how frequent workshops help dentists for the advancements of technology, to know about the advancements of technology, doctor?
Yes, we do become a dentist after the you know, passing out the course BDS, and then you can always take up the masters, which is MDS, Masters in Dental Surgery. Then apart from these two, we do take courses from time to time, very frequently.
Okay.
In what aspect you want to go, like I love cosmetic dentistry.
Okay.
So when the patient goes out from your clinic with a beautiful smile and a you know, gratitude, that is a very rewarding thing for a doctor. So yeah, from time to time we do take up courses, and apart from that we have an association of dentists where continuing dental education happens, seminars, you know, talks, discussions, very frequently, once, twice in a month actually.
Okay. Now we were talking about crowded teeth, doctor. So what can be done for a crowded teeth?
Crowded teeth, dentistry is expensive, I admit. It is not, you know, very cheap. But according to the economical status of a patient, we do give them options.
Okay.
So to take care of your crowded teeth, there are three options. One, which you can wear a you know, appliances with which you can correct your crowded teeth. Those appliances are removable appliances. You'll have to wear it every day, and then take it out, clean it, and then again wear. And you'll have to visit the dentist from time to time, where the wires are being adjusted.
Okay.
Secondly, you can wear braces, where it is fixed by the dentist, and it is a little expensive. There you get assured results, and it takes about, you know, 8 months to 12 months for a complete correction, and it depends from case to case. Now we have clear aligners, where we give transparent trays to wear. It is kind of a trays. According to the patient, we take impression, and then we make the customized tray, and we according to the defect, they have to wear for about 8 months to 12 months for a complete correction. And it also depends on the case, like how grave is your crowding, how grave is your malocclusion.
Okay. Now, doctor, which one is very much common? Which type?
Nowadays people go for braces a lot.
Okay.
And for people who are constantly in you know, in contact with the public.
Okay.
They prefer clear aligners.
Okay.
Because braces show. You know, you cannot just wear and face the camera like you do. So it is like clear aligners. If you wear, nobody can make out, and your correction is done.
Okay, okay. Doctor, we'll have more discussion. We'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Pooja. Well, Doctor, coming back to you again. Earlier to break, we had an idea about the advancement of dentistry today. Now, we were talking about the crowding of teeth. Now, why does this crowding of teeth appears, Doctor? What happens? What is the reason?
This is mainly because the milk teeth, they do not exfoliate, or they are retained for a longer period of time.
Okay.
Actually, milk teeth are not only teeth with which a baby eat, it is also a guiding, you know, tool for the permanent teeth to erupt in the correct position. So, if when the permanent teeth erupts, then your milk teeth has to go away, you know, it needs to exfoliate or it needs to be removed. So when it's time for the permanent teeth to erupt, then if the in that proper time, if that corresponding teeth does not, you know, taken off or extracted or removed, then the permanent teeth deviates its path.
Okay.
So it might deviate outwardly, giving a protrusion of the teeth, or inwardly, giving rise to crowding.
Okay, so this is the reason.
Yeah, usually children, they fear, isn't it? When their teeth, they shake, they fear of, you know, pain or
Getting
going to a
hurt.
dentist. So, and the parents, due to this fear of their children, they do not take them to a dentist or delay the process. Then the things happen, you know, crowding occurs,
Okay.
or protrusion occurs.
All right. So when is the right time to see a dentist, doctor? If you find any thing which is bothering you, so you should immediately go and see a dentist, because there are a lot of ways to beautify your smile, isn't it, doctor?
Yes, yes. Actually, pediatric, there is a pediatric dentistry, periodontics.
Okay.
So, you need to see a dentist. General dentist can also advise you properly.
Okay.
Like, you have to go and check your children. You have to take your children to a dentist and let the dentist check their teeth. Usually, what happens, from the age of 6, teeth starts to, you know,
Come up.
yeah,
Okay.
the permanent teeth comes out, like the first molars.
Okay.
Posteriorly, which does not interfere with the milk teeth, set of milk teeth, but it comes out. And then, you know, the baby or the kid might have some loose motion or that kind of thing, which worries.
Those are just generic symptoms.
Generic
Okay.
symptoms. And then from 6 years on, the interior, the first front teeth, they starts to shake.
Okay.
You know, the first indication is a little shaky. Then you need to shake it, and you can exfoliate, or you can take it out at home.
Sometimes it comes out easily also.
Easily. But if it doesn't, then you need to consult a dentist.
Okay, okay. All right. Now, doctor, after these lot of like treatments or the beautify treatments, you know, what are the precautions that the person has to take? Like, what are the things, what are the do's and don'ts that person has to take?
See, dentistry, beautifying is like, it includes a lot of procedures. Beautifying, you need white teeth, so you can go for bleaching. A regular maintenance of oral hygiene includes scaling and root planning. That is like you need to remove your stains and the calculus that deposits. That is one thing. Your natural color of tooth will be retained and your oral hygiene is maintained. But apart from that, if you want white teeth, then you need to go for bleaching.
Okay.
And nowadays there are a lot many products which has come out commercially also, with which you can whiten your teeth. Like that comes with a cost actually. When we do bleaching, there is sensitivity.
Okay.
Because we treat the bleaching procedure is taken care by carbamide peroxide, which is a little sensitive to the nerve of the teeth. So yeah, that goes off eventually, but initially the patient has to go through some sensitivity.
So sensitivity is one kind of side effects which the
Yes,
person...
of
Okay.
bleaching.
Okay,
Yes.
of bleaching.
Yeah. So, but scaling is not considered as a cosmetic treatment.
Okay.
It is recommended for everyone. Actually, we also, as dentists, we also go for a scaling to our friends.
Okay.
Like we need to clean our teeth, like the cervical portion where a thin layer of stones deposit in every person.
Okay.
That you need to clean it up from time to time. Annually, once is recommended.
Okay. Now, doctor, what is the best way to practice a good oral hygiene at home itself? Like,
The best thing you can do is, apart from the morning brushing and cleaning, you can actually should spend a lot of time at night.
okay.
So, brushing your teeth, cleaning your tongue, flossing, taking a mouthwash before you go to bed. That is the best thing you can do. And it actually, if you ask me, I spend 20 minutes before I go to bed
Okay.
cleaning my teeth. Yeah. Even then, we have teeth, stones accumulating, which we need to clean once annually.
Okay. Okay. Now, what is the role of fluoride in our teeth, doctor? There is an important role which a fluoride plays.
Yeah.
So, what is that?
Fluoride is something, it is a product, it is a, element which benefits the teeth
Okay.
if it is present in a proper quantity.
Proper quantity.
Yes, proper amount. 1 part ppm, we say. 1 part, 1 ppm should be present in water or any product that we say, like toothpaste also, fluoridated toothpaste, which does not play much of a role, but yeah, it can protect our teeth. Like it gets absorbed, it replaces the iron of our enamel. Our enamel has, if I go deeper into the medical terms, then I should be, explaining it simply by saying
And we
that.
need to extend our show also.
Yeah.
Okay.
So, hydroxyl ion is replaced by fluoride ion.
Okay.
And when the fluoride ion is present, then your teeth are protected from caries.
Oh.
That is the simple benefit, the simple explanation which benefits the teeth when you have fluoride.
Okay.
Actually. But if fluoride is present excessively, mottling of enamel happens.
Okay.
That mottling destroys the enamel structure and it comes off. And once these teeth is one thing which is not regenerative. Your bone, if it fractures, it can regenerate and become new as before. But teeth cannot be regenerated. So that is one thing which of our body which we require so desperately, but it cannot be regenerated.
Regenerated. Okay.
Yeah. So if mottling of enamel happens, then the tooth structure, the enamel structure breaks down. Then you'll have to wear a cap or fill it up with a material from outside.
Okay. So a lot of things,
yeah.
but there are advancements in the technology, so nothing is to worry, because there are a lot of possibilities which happen nowadays, isn't it, Doctor?
Yes, yes.
All right, thank you so much for joining to Good Life, the Health Show. Well, viewers, with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.